this is no fun. A lot of times you think, I'd like to wake up and have my old life back when this wasn't a part of it.
I was diagnosed a week after our daughter was born. That disease at the time was incurable, and that eventually, 15 years out, 20 years out, it is something that would kill me.
For many patients, Tower Cancer Research Foundation is the place they turn for help. Tower is a leader in some of the most progressive thinking in the battle to eradicate cancers and blood disorders.
Our foundation's mission and vision are to offer cutting-edge clinical trials, be on the frontier of cancer research and community outreach. One of the great things about this organization is that we're nimble and we're quick.
Hope, healing, and humanity are what the foundation is all about. We endeavor to give hope to patients who are hopeless. We endeavor to heal these patients for patients who are potentially unhealable. And we want to do it in a setting that's compassionate and empathetic at the same time. And the foundation has been set up to do just that.
Founded just over a decade ago, the Tower Cancer Research Foundation has greatly improved patient access to new agents and methodologies and helps patients to better understand their treatment options.
Our patients don't have a lot of options when they go onto clinical trials. Many of the patients have failed standard effective chemotherapy and their disease is continuing to get worse. Tower Cancer Research Foundation was started in order to make available to our patients state-of-the-art clinical trials that they would need to go to other cities to obtain.
As the vanguard of some of the most promising clinical trials in cancer treatment, Tower Cancer Research Foundation has often become a patient's greatest ally.
I was just getting a regular Pap test, and I requested the CA-125 blood test, and that came back real high. I had lymphoma. The reason I came to Tower was, at that moment, I really needed a treatment. My lymph nodes had grown. I was beginning not to feel so good. You want to be connected with an organization that makes me feel I have a chance. I'm with people who are smart. I'm with people who are always looking to see what else is out there and willing to take some risks. This particular treatment has done very well, meaning I was able to tolerate it well. After I'd completed 3 cycles, it was wonderful news. The lymph nodes had decreased by 60%, and there were no, except for one, no hot spots of new areas, so I was really very happy.
Tower Cancer Research Foundation's clinical trials in cancer and hematology research are leading to potential remissions and possible cures.
Spain's next to France. Who lives in France?
When I was getting insurance, I had to have a checkup, and the checkup saw this abnormality. The disorder is called polycythemia vera. It's a mutation in your chromosomes, which causes your bone marrow to produce too many red blood cells and abnormal platelets. I was lucky in that it wasn't something that I was going to die from in a year, but that disease was incurable, and that eventually, 15 years out, it is something that would kill me. 15 years from now, my daughter's not going to be married. She's not going to be graduating from college. The reality is that 15 or 20 years is not enough time for me.
It seemed that after he got diagnosed, he progressed into actually getting symptoms from the disease a lot faster, and he had to be hospitalized twice.
There were drugs that they could give you to stop the short-term ill effects of it, to stop you from having a stroke, for example, or they would bleed you every 4 to 6 weeks to get the red blood cells out of you. None of the techniques that they had developed would stop the progression of disease. 3 months ago, Dr. Rosenblum had approached me. There was a new drug that, although not a cure for the disease, would potentially arrest the progression of disease. So it would allow you to live out your natural life. I have shown a response to the drug, and obviously over time, they'll see how significant the response is. My hope is that with the care at Tower, that I'll be able to live a very long and happy life with my daughter and my wife.
My relationship with the physicians in that practice and at the foundation go back over 25 years. By working on clinical trials together, they represent what we hope is going to be the new and more successful treatments. This allows patients to realize they're getting not yesterday's treatment, but they're getting really the best we know how to do today and maybe even tomorrow.
When you give to Tower, when you participate in clinical trials at Tower, you're building up this body of medical knowledge. And it's in incremental steps, little victories. What's wonderful about Tower is these little victories are ultimately leading to cures.
And success in clinical trials is closely tied to support of some of our country's leading researchers.
Clinical trials are the lifeblood of cancer therapy. Collaborations with other institutions are essential. We have affiliations with institutions such as TGen with City of Hope and many of the large pharmaceutical companies.
With the fellowships we have here at UCLA through the Tower Cancer Research Foundation, we've had a great interaction. They have been able to provide resources to train new fellows, new clinicians, new scientists that are ready to take on the new cancer therapies, and that's been invaluable.
From support groups to the Patient-to-Patient Bosom Buddies program, nutritional care, and community lectures, the Tower Cancer Research Foundation touches patients no matter where they are in their pursuit of a normal life.
You can't just treat the body and not treat the emotions and not treat the spirit.
I think of these women as survivalists. It can be a really lonely place, a very scary place out in the middle of nowhere, but this group has become our base camp, and we come here every week and we restore ourselves.
And the Foundation's dedication to community outreach continues to expand.
One of the things that we're very excited about is called the Lipin Project. And the Lipin Project is a information bureau.
Running Lipin Cancer Information and Resource Line. This is Phyllis. How can I help you?
You know, a lot of people who get cancer get scared because they don't know where to turn to. What we're trying to establish is a place where you can go to get your questions answered.
As the Tower Cancer Research Foundation breaks ground in advanced medical treatments, through it all, Tower staff never loses sight of the human perspective, treating the patient with dignity, empathy, and caring.
I'm very passionate about the work that I do at the Foundation because I'm a survivor myself. What I would like to see for the future is more clinical trials, more research to help patients with cancer move along the road of life.
To see patients that are previously would have had death sentences that continue to live for very long periods of time and potentially be cured, there's nothing more gratifying than that.
People who do clinical trials, in a way, are like a hero, because you might be doing something that absolutely doesn't help you at all. It might benefit someone else. It might benefit my neighbor, or maybe my son, and in a small way, it makes me feel like I'm doing something important. I think I'm also lucky because I'm doing it at Tower.